Hi everybody, I am that nursing prof and welcome to my channel. In today's video, we're talking all about tonsillitis. So inflammation of the tonsils. This is a very common illness that affects mainly children. So let's get into it. So the first thing you want to know are, what are the causes? So the causes can either be viral, so a virus, or bacterial in nature. And if it is bacterial, the most common bacterial cause is Streptococcus A. So if they do have bacterial tonsillitis, which most children do if they get this, it's probably going to be caused by strep. So what are some signs and symptoms? Red, swollen tonsils, a white or yellow coating on the tonsils, or it even looks like little patches of white or yellow. Of course, they're going to report a sore throat, painful swallowing, and swallowing anything, not just, like solid foods, but even like liquids. Everything hurts when they swallow. A fever, enlarged lymph nodes, especially the ones here, right, on your neck. They can have a scratchy voice, and then bad breath. Who's at risk? Children. Now, here's to say, ages 5 to 15 are the highest risk group, so those are like school-age kids, right? Can younger children, babies, get this? Yes. And adults, absolutely, right? But the most common group of people to get this are school-age children, so children ages 5 to 15. And then the other risk factor there is school, or being in the daycare, being around other children. So being a child who's around other children puts you at risk for having tonsillitis. It puts you at the highest risk. And how is this diagnosed? Through physical assessment. Of course, we're going to check you out. We're going to make sure when you open your mouth, we're going to check those tonsils. Are they red? Are they swollen? Do you have a sore throat? Do you have the white or yellow coating and patches? Do you have a fever? All of that physical stuff. And if we want to know, is this viral? Is this bacterial? Then we're going to do a throat swab. When we do the throat swab, what we're looking for is to come back for strep A. So if it does come back for that, then we're going to know how to treat that specifically. Because if it's viral, we have to treat it differently than if it's bacterial, right? So actually, let's talk about that. Let's talk about the nurse's job and how do we treat this. Now let's talk nursing care. So some things that the nurse can do. We can provide fluids, we can encourage them to rest, we can make them saltwater gargles just, for comfort so their throat doesn't hurt so bad. Humidify the air. We can provide lozenges as long as they're, old enough. If they're a school-age child, so at least 5 years old, then it's safe to give them that. If they're younger than that, we kind of want to hold off because there's that risk of aspiration. We want to assess for bleeding, treat any pain or fever they might have, provide education to mom and dad, and then the two most common ways that tonsillitis is treated, antibiotics, and if it's frequent, so they're getting them a lot, surgery. So removal of the tonsils, that's called a tonsillectomy. When it comes to education for mom and dad, we want to make sure that they understand appropriate ways to control the child's pain and what are safe medications to use. So this can be treated with an over-the-counter medication. The best one for this is Tylenol, okay? So acetaminophen. Aspirin, we don't want to give that to kids anyway, and ibuprofen, both of those can cause bleeding, okay? And we don't want that to happen, especially after surgery. So acetaminophen is the #1 choice for this. We want to encourage them to rest. Now, these are kids, right? We're not expecting them to be on bed rest and not get up and do anything, but just a little bit more chill at home, okay? Not as active and running around like normal, okay? So just kind of taking it easy. They can return to school usually in about 10 days. We want to make sure that the parents are reporting any bleeding. Avoiding fruit juice, so like citrus fruits like orange juice or grapefruit juice, that kind of stuff, that's going to burn. That's going to hurt a lot if they try to drink that. We can offer them soft foods as tolerated, so things like popsicles, mashed potatoes, jello, that kind of stuff. Avoid smoke exposure, so like secondhand smoke, so keeping them away from that kind of stuff. Other things that parents need to know If they do a tonsillectomy, it's going to be an outpatient procedure, so the same day. They're not going to be admitted to the hospital and stay overnight and things like that. That's not normal, at least. So mom and dad are really going to be the ones taking care of them at home after that. And then the other thing, if they get the other treatment with antibiotics, they're not going to usually be in the hospital on IV antibiotics. They're going to be on oral antibiotics. And so they'll be doing that at home. And so mom and dad need to know that the child needs to take the full course of the medication. So not just stopping taking it when you start feeling better. You need to take all of the antibiotics. Now let's talk about some potential complications and ways we can prevent this. The last couple things I wanted to talk about were complications and how do we prevent this. So the two biggest complications are bleeding and infection. So to avoid bleeding, the best thing to do would be to avoid giving aspirin or ibuprofen containing medications for pain. So we talked about it before, but acetaminophen, that is the medication of choice for this. And then when it comes to infection, you want to monitor for fever. That's going to be the big thing, especially if you're at home and you're not at the hospital. So fever is going to be your number one. Biggest thing you need to know about this is it is contagious, okay? So people can spread it to other people. Kids can spread it to other kids. So the best way to prevent it, wash your hands. So teaching them good hygiene practices, good hand hygiene, not sharing food and drinks with other people, and then to change their toothbrush. So if they're having any symptoms or they have been officially diagnosed with tonsillitis, get a new toothbrush, okay? Don't keep using that same one that you were using because you're just going to keep reinfecting yourself. So, good hygienic practices, that is the best way to prevent this from happening. So that was my video on tonsillitis. I hope you found this helpful. Don't forget to like and subscribe. If you have any questions or comments, please let me know. And if not, I'll see you on the next one.